So this video is about you trying to find the right dentist, trying to make sure it's the right fit. We are all different kinds of personality. You guys are all different kinds of personality. So how do we make it work? It's really important, really, really important, because I feel, or at least if you come to my practice, there is a connection. There has to be not only that comfort level of my hands working on you, but there has to be that comfort level with the relationship. It's actually incredibly important, and it's one of the pillars of my practice. So I guess we could start with, what is it that you want, right? What is it that you want out of your dentist? What is it that you want out of your practice? And there's many different things. And, by looking at all of these different things, maybe this could help you try to find the right fit for you. So let's just get started in terms of the practice that you're going. It's really important to understand what it is that your goals are. If you're the kind of person that, just breaks a tooth, wants to go get that one tooth fixed, and that's it, there's plenty of dentists that do that. If you come to my practice and you broke a tooth, I'll definitely help you with that tooth. I'll put the fire out. I'll make sure that we take care of that. But I'm going to want to look at why that happened. I'm going to want to do a comprehensive exam, make sure that I analyze everything, because there's two parts of that. I want to make sure that whatever I did lasts and is predictable. But I also want to make sure that I'm setting you up for success, and that I'm taking care of not only that just one thing that broke, but if I don't look at the overall picture, the big picture, like holistic, how it relates to your body, medically, to other things that might be happening, how you're sleeping, all of those things, then I feel that I'm not really helping you. So make sure that, once you know exactly what it is that you're trying to achieve with your visit, it's just something that we both kind of are on the same page. And usually that almost happens from the beginning, from the phone conversation. You'll see if my team member or a team member of any dental office doesn't really show much interest in how things happen or what it is that you're looking for, you might get a disconnect, because that might be what I want to do. But then, when you get there and I'm talking about other things, or I'm talking about trying to dig a little bit deeper and try to figure out what the cause of the broken tooth is, then that might just not be what you're looking for. So make sure that in terms of personality and what your goals are for your health, go a little bit with the personality of the doctor that's taking care of you. Like I said, usually a good way to look at that is when you call the practice, or when you call the dentist, and your team, when they're if they're really sweet and nice, or they're just appointment, here you go, bye-bye, you will know that practice is a little bit more of, in and out kind of thing. Some of these are almost like factories, in and out, here it is. We try to take care of the person. We know you by name. We know your family. We know what's going on. There's that relationship, not only me, but my team as well. So it really depends if you like that cozy feeling of, somebody that's really connected with you, or if you just want an in and out kind of thing. You're just a number and you just want to get on with your day. If you want to get on with your day, I understand you're very busy, and I am too, but we can, help you get on in a very efficient way, but still taking really good care of you and having that connection. So that's one thing I almost think it's almost the biggest thing for me, because I want to make sure that I take really good care of you, that I connect with you and with your needs and with your goals. So that's one. Number two, you need to look at the practice itself and the technology. If you don't really care about technology, you don't care about, doing things the old school, and you don't really see the benefit of having those things in a practice, then that's just not something that you care about. Then that's totally okay. if you're into high tech, if you're interested in, the modern way of looking at things and technology and all of that, then just make sure that the practice that you're in, you're going to see a lot of that, because there's a lot of technology in dentistry. We just have so many things that really help us with our knowledge, diagnose, and just have all these tools to really help us put everything together. So some examples of that is, instead of like the old school, x-rays, we now have digital x-rays. And the beauty of it is not only the convenience, you see it right away on the computer screen and you see everything, but also it's you're part of that communication, because you're seeing in the screen and we're making decisions together. We're co-diagnosing together. The other really cool thing about digital x-rays is, the radiation is a tiny fraction of what it used to be with the old school x-rays, so that's a huge plus. Another big part of modern practice is having an intraoral camera, and it's almost like a pencil, and it goes tooth by tooth, and it really gives us this macro picture of the individual teeth, and that really helps us communicate with you with what my eyes are seeing. I have magnification, I can see things really big, but it's different if you can't see it, right? So it helps me communicate with you what my eyes are seeing. I actually take you on a tour of all those pictures. So that's another cool thing about technology. And it's really funny because all of these things that we do, and there's other things that we do with technology, help us being so much more thorough than we used to be able to do it just with our eyes and with the old school x-rays. So the other cool thing is we not only take the intraoral little pictures that, give me each tooth really big, but there's also, we take a series of digital pictures to look a little bit more at the big picture, to look at the proportions of the teeth, how they interact with each other, being able to see the smile and all of those things. We also take video to make sure that, that we understand how your teeth relate to your face and to your dynamics and how you speak and how you smile. So besides the practice and all the technology, like we said, digital x-rays, scanning, three-dimensional scanning, CBCT, all of those really amazing things that help us diagnose. Besides having a practice that has all of that, you also need to find a practice that has the philosophy of, big picture, holistic, taking care of you. And that goes from the moment you walk in, through the way that you feel, to going all the way back, and those relationships. So that connection not only goes with your dentist, but also with the team. And, even look at the way that the team interacts. Even look at the way that the chemistry between them. Are they having fun? Are they laughing? Is the dentist in the chair with the assistant? How does the dentist treat the assistant? Is there respect? Because I think that does say a lot about the kind of person that you're dealing with. It's really important, I think, that if you're dealing with a person that's very respectful to their team, that just says a lot about how they think and how they treat people in general. So kindness is really important, not only towards you, but also towards their team, and the chemistry around the team and the energy that you feel in the practice. Another really, really important thing is the variety of procedures that are done in that practice. Usually, there's the general dentistry being done, and most specialties take care of like different things. Now, if you have a highly trained dentist, or even a dentist that's highly trained in most things, and then like sometimes a specialist will come in-house, then it's almost like everything under one roof. And usually you guys are just so comfortable and so happy to be in the office that whenever possible, if it's something that we can take care of, you really, really appreciate that. So with that and the variety of procedures that your dentist is skilled and has the knowledge to do, also comes the amount of continuing education and the amount of training that the dentist continues doing even after graduation. So that's a really, really big one for me. I personally think, in this journey, in this practice of dentistry, you just never stop learning, and there's always a different way to approach something. There's a ton of ways to do one thing in dentistry. So I think it's really important to stay open-minded and to always be learning different ways of doing things. And I mean, I'm big on that, not only for me, but also for my team. Study clubs, whenever I can take them to a conference. If I'm presenting, they want to be around. So it's just that whole chemistry that happens in the environment in a learning environment. So I think that's just really, really important for you to find out how active your dentist is. We do have a minimum requirement for our license to be renewed, but a lot of people can do those minimum requirements with some online stuff that they do, and that's it. We spend a lot of time staying up to date so that we know the new procedures, the new materials, and new things. Another really important thing is, that comes with the learning and comes with the advancement of things is, the quality of materials they use, what kind of materials they use, the materials, the equipment, the instruments we use, because you could practice dentistry with the exact same instruments from 100 years ago. You could. But there are so many things that are changing that make your experience so much more comfortable with modern dentistry that, sometimes patients have had a long relationship with their dentist for a really long time, and then they got a little bit older, and then they retired, and they come to us, and they're just amazed at all of the different things that now we're doing. And I love long relationships with their dentist. Even if you come to me and you have a long-standing relationship with your dentist, I will try to figure out a way that maybe you can communicate with your dentist so that you can keep that relationship and stay with your dentist. But, sometimes when they retire or you move, then you come to this experience, and it's just a really beautiful thing to be able to understand how different and how dentistry changes literally, just especially now with the digital era, like it changes every month. So it's really cool to stay up to date with not only the technology, but the materials, the instruments, and the equipment as well. So that's really, really important to know and to pay attention to. Another big part of a dental office is the hygiene program, the hygiene department. The hygiene department is when you come to get your cleanings and your therapy and all of that. Now, there's cleanings and there's different things that we do to really keep your gums in tip-top shape. And there's just the regular cleaning, that gets done. Now, if you're healthy and all you need is like the regular cleaning, then that's great. But there's some hygienists and there's hygiene departments in some offices that, you're like in and out. Unfortunately, this usually will happen in an environment where there's like a high volume practice where it's like you go in, you get your cleaning done in like 15-20 minutes, and then you get out. And really, that's a very limited time for us to really get a chance to really go in detail everywhere. Even if you're a healthy patient, actually, 15-20 minutes is a very short time. We usually provide a full hour for the hygiene appointment. Not only so that we can do your cleaning, but we can examine everything. We can take pictures if we need to. You also get, that connection with your hygienist and the person that's taking care of you. But if you needed a little bit more detail, more of an active therapy because there's some active disease, we're able to catch those things earlier, and we're able to really pay attention and grab it right away instead of just waiting until disease happens and then we're looking at, something major that we need to do about your gums and your bones. So the hygiene department is huge, especially because once we're done with the dentistry, if I need to do any work, you'll just keep seeing our hygienist, and it's just a really cool bond that develops with your hygienist and the person that's, taking care of that. Another huge subject is how clean is this place? That's a big one. In dentistry, I think it's a huge one. We are super proud of, how we keep everything clean and organized. Our sterilization area, it's a very, modern system from dirty to scrubbing to sterilizing to packing and sterilizing and everything. So that's really important. I mean, the instruments that I use on you are the same instruments that are being used on me. That's how much I trust the process and how proud we are to make sure that everything is perfectly clean. It's actually really cool. Even when we're done for the day, we're completely done for the day. And when I do the last walkthrough, if I'm going to go lock the front door and I'm the only one left in the office, it's always beautiful to just walk back and walk through the operatories and see everything tucked in, perfectly clean. Even though we're done, for the day, they could just, leave things kind of disorganized and then just clean it for the next patient. But it's almost that philosophy and that culture of, making sure that everything is always perfectly clean, that I think it's really important. And actually, a lot of dental reps or people that come visit actually refer patients to us because they'll say, like, this office is so clean, and it's, like, and that's just really important. When you know dentistry, you want to be somewhere where, like, cleanliness and things being really nice and organized is really important. So it's a huge compliment, actually, when people from the dental field send us patients, because they know and they visit different places. So make sure that you keep an eye on, how clean, not only the office, but actually also the team members, how presented they are they professional, how they relate to you, how they talk to you, are they respectful, are they kind, are they sweet, do they even care about you? So it's cleanliness in the office, but the cleanliness of the person also taking care of you. So that's a pretty big one too. Another really important thing, especially in this modern era where we can communicate at all times, is how much access do you have to your doctor? So that's a tricky one, right? Because we take care of so many people, and of course you can't have absolute 24/7 access to us, but I do think there needs to be, direct access. If it's something that my team can handle, absolutely, I trust them 100%. But if you need to, talk directly to me, you have access to me. Another thing that I do is, if I've done a big surgery, if I've done a big procedure, you always have my cell phone. And I always tell you guys, you can text me at any time, any day, no questions asked. If something were to happen, if an emergency were to happen on the weekends, you're my patient, I've been taking care of you, and something were to happen, you broke a front tooth, or, you're in pain in the middle of the weekend and you're, under my care and I know you, I'll make sure that I'll facilitate something for you so that you're comfortable until you can see me. And I think having that kind of access, I mean, even in Instagram, or even in, patients are always interacting with me. So I think there's something really cool about having a bit more access to your dentist, even if it's just to say hi, or to say I'm thinking about you. I know that sounds kind of cheesy, but that's actually the kind of messages that I get. I got a message on Instagram the other day on a patient that I'm about to deliver their Invisalign, and it was just the sweetest thing. It made my day. It was something like, I can't wait to see you. I've never been so excited to go to the dentist. And even those messages, I mean, you have direct access to me. I will reply as well. But just having that cool communication, that cool access, and almost that extra connection, I think there's something valuable to that as well. So another factor that may surprise you is proximity and access, physical access to your dentist. You'd be surprised at, the lengths that some patients would go to the right person where they've connected, and it checks so many other boxes, but they're simply too far away from them. And I have patients that will actually travel from very far. I have patients that will travel out of the country. We're talking about comprehensive, complex treatments that we're doing, because at this day and age, with the way that we can communicate, with the way that we can do things, understanding the distance, it's quite easy to actually take care of you. I have patients on Invisalign that are long distance. I have patients that I'm doing smile designs and long distance comprehensive treatment, full mouth reconstructions that are long distance. So if you thought I was going to say that the proximity and being close to your dentist in terms of where you live is important, I disagree. I think the most important things are, there's so many other priorities than the proximity. And if you found somebody that you connected with and you feel comfortable with everything else, that tops everything. I'll travel for my physicians. I think that connection is that much more important than me just driving 5-10 minutes to be able to get there. So, of course, if you have somebody that's close by and you have that connection, even better. But that's not always that easy. So, just make sure that once you've connected, it's totally worth it to travel to go see your favorite person. One last thing on how to find your dentist. And, this is a double-edged sword, because social media, social proof, reviews, it's a very powerful thing. And, luckily I've gotten a lot of love from you guys, and I've gotten a lot of really positive feedback. So I think it's okay to say that finding out reviews and finding out what other people think. It's really important to be able to find your dentist, especially if in the review they comment on some of the things that really, strike you as important. However, just be mindful that, it's a double-edged sword, because there might be some people that anonymously might want to, might have had a misunderstanding or a miscommunication, and they take it in the public forum, and it's very, very difficult to be able to reply to those things, because we do have laws that we need to abide to. And so just be mindful and try to look at the combination of everything instead of just looking at one thing. I personally think, and this, I'm going to finish my video with this, social proof and reviews are amazing, and I'm very thankful for all of the positive feedback that I've gotten. Truthfully, I will almost say the best way to find your dentist is to just ask around, ask your loved ones, ask your friends. Word of mouth, once that person has met, they know your personality, they know the personality of the provider, and it's almost a match. And usually when your friends love somebody, if they're your friends, you have a lot in common with them for the most part. And that's usually the best way, because now you're coming knowing me a little bit, knowing how I treat people, how I treated your friends, how I treated your family, and you have an idea of who I am already. And usually that connection, that word of mouth referral, is actually the most powerful connection. So that might be my number one way of finding the right dentist for you. So hopefully this was helpful. Hopefully this, gave you some ideas on how to find that perfect person for you. And I tell all my patients, I think it's important to take the time to really find that person, because this is a connection and this is a relationship that could truly last for the rest of your life. So hopefully this was very helpful, and hope to see you soon. Bye-bye.